Hello, welcome. This is the Mental Hub. My name is Dr. Pamela, a counseling psychologist based in Nairobi. I am here to begin a new platform where we discuss matters mental health. Professionally, a trained psychologist practicing in Kenya, registered by the Kenya Counselors and Psychologists Association. In addition, I'm also a member of the International Society for Substance Use Prevention, that is ISAP, which is a global platform of professionals that deal with matters addiction. The Mental Hub, as I have said, is a platform that is trying to raise a community that can speak on matters that influence the way people function on a daily basis. Life is nothing. Life becomes difficult if you are not able to feel that you are contributing to the society and you are handing value to the population or the community that you belong to. Oftentimes we find in life, you may feel lost in the crowd. And at the end of it all, you will feel like you don't value self because you are not able to contribute on a daily basis to life and living. As it is, every human being is important. You have a position on this earth to contribute to. And therefore, if you are not functioning well, it makes you feel like you are not handing value not only to self, but the community. So the Mental Hub is a platform to reach out, share information, interact, engage, share our experiences, interact with information, research, what's happening in the community, what's happening to individuals, what's happening in families, and more so as it relates to health, and specifically mental health. Mental health because a human being is a 3-in-1. I look at life or a human being from a 3-in-1. You have a spirit that has a soul and you live in a body. The 3 aspects of a human being have to interact and in a way that none is suppressed, so that then you are able to perform, you are able to cope with the normal stresses of life. WHO, or the World Health Organization, defines health as not necessarily the absence of an infirmity, but to be physically well, psychologically well, emotionally well, spiritually well, all aspects of life. I will look at this from a bigger picture. Today, the world is a global community. We have goals that nations have set. The goals today we are calling the Sustainable Development Goals. These goals are dependent on people to fulfill them. They are meant to make life in the globe profitable so that individuals, societies, communities, nations can be able to progress or develop in a sustainable way. In the African Union, we have the Vision 2063. We have goals that have been set. It will cause for us as the population in Africa to be able to achieve these goals. In nations like Kenya, we have the Big Four agenda. The Big Four agenda really is driven by the people. It doesn't matter what kind of infrastructure we put in place. As long as the population is not healthy, it means that our development is not sustainable. That is why it is important to focus on the aspect of mental health. globally, challenges are emerging as it is in life. Really, challenges are good, problems are good, because at the end of the day, we look for solutions. But then, if these problems, we are not able to cope with them as individuals, as societies, then we will not be able to achieve sustainable development. And that's why we need to look at the mental health of the population, the mental health of the individuals, the mental health of the families. At the end of it all, when all is said and done, if an individual has no energy to wake up in the morning to go and do what they know what to do, if one is feeling hopeless, if one is anxious, if one is worried, if one is sad, it's an indicator that mentally one is getting dysfunctional. And if this is not addressed, it will definitely impact on not only productivity, but even the physical wellness of a person or the physical health of this person. So mental health is very, very important. And it is affected by so many aspects. Availability of resources, or either the financial status of an individual, the increasing poverty levels are influencing the mental health of people. The conflicts in the society in terms of relationships with self, with others, also affects our mental health. And as it is, we human beings are social beings. So if we cannot be able to cope with the conflicts that arise on a daily basis, even at family level, in the workplaces, in the society, then we become dysfunctional and it becomes difficult for one to live a normal life. What of society? Today, when you look in our society, there are challenges that are emerging from conflicts, even between communities, from poverty. There are challenges that are emerging from disasters that societies are faced with. When there are conflicts within a community, when trouble strikes, when there are nations that are having wars, either nation to nation, or within one nation, a community with another, what does that mean to the mental well-being of the people? Therefore, it becomes important to focus on mental health. On a daily basis, you will hear reports of people committing suicide. And this has gotten to a level that even young children or children really are committing suicide. What is the basis of this? It is an indicator that people are not able to cope with the daily stressors of life. Challenges are becoming many. So we cannot bury our hands under the sand and assume nothing is happening. It therefore becomes important for all of us to create a community that can actually discuss issues concerning the mental health, not only of individuals, but also of the society, before it becomes a big challenge really, or a pandemic of proportions that cannot be managed. Life has meaning. So this platform is an opportunity to give meaning to life in the midst of the challenges of life. As it is, we cannot change. We cannot have an ideal situation. Reality dawns. Losses occur in the community. May it be loss of property, loss of life, loss of relationship. It means a lot to an individual. And if this is not addressed, then it could spiral to an extent that one is mentally unstable and therefore not able to live daily and feel their value for their lives and value for other people. Globally, it has been documented that well over 450 million people globally are living with one mental disorder or another, or have been affected by one disorder or another. That is a big population that is supposed to actually drive the economy of nations. So if we don't address this population, then we are not going as a global community, as a people, to say we are productive. The young people today are so much involved with technological gadgets, and they are exposed to even a world that is so scary. What does this mean to the young people? If the young people or children who are growing are being exposed even to terror or to harm, to worry, to anxiety that is emerging from away from the society that they live in or away from that family because of the gadgets that we have, then we need to be wary that at the end of the day, globally, we are one and the same people, and we have to focus on what does this mean for our people. Mental health is not only about adults. It cuts across the ages. It cuts across gender. The young are affected, the old are affected, the learned are affected, the people we say are lower in the ladder of life are also affected. It doesn't matter who it is. Anyone is predisposed. But then we need to be able to look out. What are these factors that would make people develop, or an individual develop a mental disorder, or an individual with a mental disorder progress to an extent that they don't become functional? So we need to be able to identify what are the risk factors, which groups are more at risk of developing mental disorders. What does this then mean? What are the interventions that we can put in place? What are the causes of mental disorders, or what are the predisposing factors? How can we be able to identify them and respond early enough so that then we have our people who are able to function? Get into the depth of it. In all the social or the sectors of the economy, how does mental health manifest? Amongst people in a workplace, what does mental health mean? In a society, what does mental health mean? In the religious sector, what does mental health mean? If we are able to bring all these together as this community, the mental hub, then we will be able to identify, and correctly so, a mental disorder. We are able to identify it early. We are able to manage it and enable a person to cope, so that then we reduce the burden of disease in our community. Enough of people or lives being lost because of mental disorders, which are conditions that can, if early diagnosis is done, early identification is done, then this person can be helped and they are able to live a better life. A study indicates that in the health facilities, or even the people inpatient in hospitals, a greater percent of them are there for mental disorders that have not been diagnosed, and therefore treating physical illnesses which do not exist, if I may say so, but it could be a mental disorder that has not been diagnosed. Therefore, the person probably being treated for the wrong thing. So if awareness is raised in the community, if more people get to know what to do, how to identify, how to prevent, how to manage, how to support, then we will be raising a community that can be supportive. We will be raising a community or a network of people that are well informed. Information is power. And I know, we all know that information is power. And the gap of information that is lacking in mental health is that which we will be addressing in this platform. So I ask you to join me and subscribe on this YouTube channel, like, share, and inform as many people as possible. And I welcome you to ask questions. I welcome you to engage, and let us develop a community that can be able to address the issues that emerge, so that then we have a population that is healthy. Welcome.